So welcome, Professor Ajay Shah, to our Spotlight conversation, and thank you very much for joining us. Now, you're, I know, a clinician scientist, but do you want to just tell us a bit more about both your background and indeed the areas that you have a particular interest in?
Thank you. Welcome, everyone. So I'm an academic cardiologist. I have been and remain an active clinician. I have a big research interest particularly in heart failure, in the pathophysiology of heart failure. And here at King's, we're fortunate enough to have a British Heart Foundation Centre of Excellence, which I direct, which is a fantastic centre with about 100 principal investigators and a wide range of different areas of cardiovascular biology and medicine that people are investigating. So I think we have a really good environment where we have really good science and very, very good clinical activity, and we try and join the two things together so that we can constantly improve.
And so with such a busy centre, what has drawn you and perhaps some of your colleagues into directly engaging in COVID-19 related research?
Well, in a way, we're all want to do something, don't we? But when it comes to cardiovascular, it's extremely striking that patients who have pre-existing cardiovascular problems like high blood pressure, diabetes, heart failure, are much more likely to develop severe COVID disease and to die. And so it's an obvious question for us to look at and try and find the answer to.
Do you want to just tell us briefly the approaches that you've been taking in seeking to gain some further answers to some of the obvious cardiovascular complications that we're hearing about?
Yeah, so there's a range of approaches. I think that the first approach, when you have a completely new condition, is actually to look at the patients who are coming in and carefully assess exactly what is happening from a cardiovascular point of view and use the clinical data to learn more about the condition. So that's one big approach. And in that approach, we are very fortunate in being able to work closely with experts in analyzing electronic health records so that we can rapidly obtain information about what's happening. That's sort of one extreme. I think the other end of the spectrum is studies that are in the lab to try and tease out some of the mechanisms that are responsible for this connection. So we think that it might be related to potentially to a direct susceptibility of cardiovascular cells and tissues to the virus. So that's something that we are trying to explore in the laboratory.
We usually characterize those sort of studies as being quite some way from a timeline for actively and impacting on the care of individual patients. And given the severe and acute nature of this condition, do you have a sense of what sort of timelines you might be dealing with in terms of developing ideas on at least new treatments?
Well, some of the work, a lot of the work that we're doing on the clinical information actually is potentially applicable very, very quickly. So if I give you an example, when this crisis started, one of the big questions and unknowns was, what should people who take ACE inhibitors, very, very commonly used drugs in the general population, what should they do? Do ACE inhibitors increase or decrease your risk of severe COVID disease? And there are good theoretical reasons why you might argue either way. And what we've been able to do very rapidly is to provide initial evidence, quite good evidence, I think, that ACE inhibitors are not harmful. If a patient is taking these, or if a person in the general population is taking them, they should continue to take them. We have not found any evidence of harm. So that's just an example of something that is immediately translatable. And we are learning more and more about the cardiac complications that patients develop with COVID disease, so that if we're unlucky enough to have another peak, or if the infections continue over the next few months, I think that we're going to be much better positioned to deal with these problems because of what we're learning at the moment.
Well, just to finish, perhaps you might say a little bit about your own view on the sort of outstanding characteristics that you've observed from the way in which King's College London has responded to this pandemic.
Oh, it's been absolutely heartwarming, I would say, and hugely impressive. And I say that not because I'm a member of staff of King's College. I think the way in which people at all levels have really come together and done small things and big things, all in an effort to try and deal with this pandemic, is frankly nothing short of extraordinary. From scientists who are doing completely different things, who are turning their science to try and find solutions to COVID, to people who are volunteering, to people who are trying to do things for mental health and so on. It's absolutely extraordinary. And I have to say, I feel very proud to be part of King's at this time.
Well, Professor Ajay Shah, can I thank you and those you're working with for all the effort and all the work they're undertaking. Thank you very much for joining us today.
Thank you.